The sudden death of a young, apparently healthy athlete is tragic, and it's devastating to family, friends, and the community. We spoke with cardiologist Dr. Ramin Manshadi and asked him to explain sudden cardiac death.
Everybody should know the risk factors, cardiovascular risk factors. If you're younger than age 35, one should be aware of conditions that maybe these individuals are harboring that never gets detected, and once they're older we can detect them. And those are the most common cause in the United States is hypertrophic cardiomyopathy, which I'll define, arrhythmogenic RV dysplasia, which is basically the heart muscle not developing well, and another one is anomalous coronary arteries. And basically what happens with anomalous coronary arteries, these arteries are the ones that if they get plugged up suddenly, then one ends up having a heart attack. In young athletes, or athletes in general, but younger than 35, one condition is this main artery that's coming down, which gives off this side branch, it's called circumflex artery and the LAD. This is the left main artery. Instead of coming out right from here, it comes out between these two big major arteries. So when you exercise, these big arteries engorge with blood. It basically compresses this artery, so then you do not get enough oxygen that comes to the heart muscle, and it can propagate ischemia, which subsequently can propagate arrhythmias, which is chaotic electrical rhythm, and the pump fails, and unfortunately these young athletes can collapse and die. So this is one. Hypertrophic cardiomyopathy is basically there's a thickening within the septum of the heart muscle. So this is the left side of the heart where it basically pumps the blood to everywhere in our body. This area becomes quite thick and inhibits blood flow getting pumped out, and the muscle is not generated well. It can also lead to arrhythmias and sudden death. There has been many events out there, maybe up to 200 or more per year for young athletes, high school athletes, that basically die suddenly on the field and collapse. So there are two levels where we can prevent this: at the pre-participation exam, where we have more competent physicians doing the exams and doing the right testing, and at the level of the event itself. If someone collapses, then we can use an AED or automatic external defibrillator to bring these individuals back. But these athletes are very healthy otherwise. So the only thing that makes them collapse is these arrhythmias that are propagated by these heart conditions that one was never able to detect. So survival is and the prognosis is very good in these individuals if we do the right things for them. So it's very important to educate the masses regarding this so that we know what we're doing. At the same time, we're not scaring people from exercising, because I truly believe exercise is a magic elixir. It can truly help an individual. I even give advice to my cardiac patients that if they are feeling under a lot of stress and they ask me for anxiolytics, Valium and so forth, I would say go and do exercises. Then the body itself will release these hormones that will make you feel better. You do not need it.